Perfect. Yeah, so thank you very much for the opportunity to present to you today. So I suppose I wanted to frame my input around the kind of unprecedented situation we found ourselves in at the start of the pandemic. And the reason I wanted to do this is to talk about the way that healthcare systems have had to respond to the pandemic. And that includes rolling out solutions like ours and how that manages people's data. Towards the end of February last year, we all started to see that COVID was coming near to our shores, and the frightening scenes we saw in Italy where healthcare had to be rationed. Ambulances were queuing to bring patients to hospitals. And we know so much more a year on. We know that as healthcare systems got overwhelmed, the death rate increased. People who would have survived ended up dying. And it was incredibly difficult to understand who needed the precious in-hospital care. A patient could be anxious and breathless, but not suffering severe COVID, where their oxygen level was dropping. Likewise, some patients could feel perfectly fine, and they were in fact severely ill, a condition called happy hypoxia, where their body was being starved of oxygen and they were completely unaware of this until it became too late to treat them effectively. We've been working with hospitals for 5 years before the pandemic, primarily in chronic lung disease, in helping hospitals manage patients at home. And we adapted our solution for COVID-19 to help them manage those patients at home. It measures a patient's oxygen level with a smartphone app and a medical grade device called a pulse oximeter, which is the device that a patient puts on their finger to measure their oxygen level. This data is relayed back to the GP or to the hospital, and it could automatically alert them when a patient was getting into difficulty. This allowed the HSE to expand their capacity, effectively providing a high level of care in people's homes. If you were watching Claire Byrne live back in January, you might remember they had an episode where it was coming from the car park in the Mater Hotel. It was a horrible, wet and dreary Monday night. And in that program, the Mater said that they were managing close to 200 patients in the hospital, but 50% of them were getting a high level of care at home. And with our system, they were able to identify patients who needed to be brought back into the hospital. Often it was patients who were severely ill with COVID, but they could manage them effectively at home because they had access to the data to understand their current health status. So for the health system, this provided them with many benefits. So it helped them to preserve hospital resources and freed up the capacity for the sickest patients. So the situation that we saw in Italy, where they didn't know which patients needed the access to the fine level of care in the hospital, we were able to help the HSE in providing that level of triage. They could understand who needed that care, but everyone could be provided with care safe and effectively. It allowed them to triage who had severe COVID-19. And the other thing that was important was patients who had COVID, there was an indication that as you got more viral load, you became more severely ill. So actually the best place to be managed if you didn't need to be in the hospital was at home. So for consultants like Eamonn Barra, this allowed them to discharge patients earlier, and the data was instrumental in helping them understand the disease further as well, which I'll get to in a little while, talking about research aspects. Again, this is a doctor in primary care, so it allowed them to know which patients needed admitting to the emergency department and who were just stressed and anxious. Yes, they were ill with COVID-19, but they did not need the precious hospital resources. And this is a patient who gave permission to share her testimonial. So we got this feedback repeatedly over and over again from patients. So those that, thankfully didn't need to go into the hospital, or who were discharged home and didn't need to go back in, it provided them with massive level of reassurance that even when they were stressed and breathless and anxious, knowing their oxygen level provided them with a reassurance that they were being okay. And the hospital was able to contact them if they needed admission back into the hospital. So as I mentioned, we were working in this area long before COVID. And I suppose what COVID has demonstrated is hospitals can manage patients in a different way. And HSE and other hospitals we're working with in the US, the UK, and Germany are really starting to accelerate managing patients at home. So why do you need to travel, kind of a couple of hours to an expert center to have your lung transplant managed if it could be done remotely and if your condition is stable? And likewise, patients often are having an issue at home and it's not being picked up early enough. So they can get care much more quickly, much more effectively with this approach. COVID actually, interestingly, was the first solution we deployed where we hadn't worked with patients, and you can understand why it wasn't possible in this situation. So we have long-standing kind of relationships with various patient organizations, most notably a group called the Irish Lung Fibrosis Association. But this was, tweet from a CF advocate and Cystic Fibrosis Ireland just recently talking about the work that we're doing with CF patients. And again, they're a vulnerable patient population who were prone to picking up infections ever before COVID. And then solutions like this has allowed them to have, an expert level of care being provided at home without needing to attend their hospital. So we deployed this solution for the COVID monitoring back in March with the HSE. So you can imagine it was a pretty frenetic period in terms of getting the whole system tested, deployed, rolled out, and hospitals and doctors and nurses trained up around the country. But what I do want to stress is, despite this urgency, we were able to follow kind of what I would kind of term kind of due process. So there was full security review put in place, data processing agreements and data protection impact assessment was carried out. So what I also want to stress is we're a data processor in this instance. We're not the data controller, so we're helping the healthcare providers manage the data. And also consent was secured from patients who were put on this pathway for managing their care. There was a primary consent and also a secondary consent for research purposes. And also we had an independent assessment carried out of our solution, and it was submitted to the Data Protection Commissioner because our solution was getting a lot of publicity, in March and April timeframe. So the Data Protection Commissioner has a duty to investigate in that situation. And, so kind of what I want to say is that I don't believe, doing something rapidly, it can be done effectively. You can follow kind of due process. So I just want to touch on a couple of points just before I finish up in terms of kind of the research side of things. So I mentioned in our COVID solution, we gathered secondary consent, and medicine is all about evidence-based. So, kind of, we all know about the vaccines. So there's been clinical trials and evidence generated in terms of their safety and effectiveness. And likewise, so this is, there was kind of research papers published by, St. James's Hospital, St. Vincent's Hospital on our COVID-19 solution. And this is important for health systems to demonstrate the safety and effectiveness of solutions like ours as well. So what these research papers demonstrated was our solution was safe, it was effective, and it allowed them to manage their patients more effectively than they could have done if they were bringing everyone into the hospital. Other non-COVID research we're involved in is an example here. So again, with this type of research, we're studying, or we're looking to develop a new digital healthcare intervention. But in these situations also, we are getting ethics approval from the hospitals, we are getting consent from patients, and we're working collaboratively with the health system. So that was all I wanted to kind of cover today. Hopefully it's given you a flavor in terms of what solution providers like ours are doing in the health system and how it benefits both the health system, the clinicians working in it, but also the patients who are the ones whose data this is using.